All right. Well, good evening, everyone. I believe we are at 7 o'clock Central, 8 o'clock Eastern. So thank you so much for joining us for our webinar tonight. We are going to be talking about FES cycling and hopefully answering if FES cycling is right for you. My name is Liz Fuhrhop, and I am a physical therapist, and I'm the clinical support specialist for MYOLYN. Joining me this evening is Deb Cerisi. She's our home client advocate. So we're jointly presenting this webinar for you, and we're just really glad to have you along. I do want to point out that we have a chat and a Q&A that you'll see on your screen. So if you have questions that come up during the webinar, feel free to type in your questions. We'll do our best to either answer those as we go, but we'll also dedicate some time at the end of the webinar to answer any questions that you might have. So without further ado, we will just go ahead and get started. All right, so this is our agenda for the evening. We are going to introduce ourselves a little bit more formally. We are going to answer your questions about what is FES, what is FES cycling, who is FES cycling for, and how you can start FES cycling. And then again, we're going to leave time for questions at the end of the webinar. So just a little bit about me. Again, I'm a doctor of physical therapy, and I'm the clinical support specialist for MYOLYN. I just hit my 2-year anniversary with MYOLYN. I'm based in Chicago, Illinois. I've been using FES cycling in my practice for over 6 years now, and it's really my passion to work with both clinicians as well as our home users to just help people understand the many potential benefits of FES and FES cycling. So in my free time, I love to travel. This was a picture of me last month. We went to the Azores, which is an island chain off Portugal. I love to shop at vintage and thrift shops and lift weights. So it's a little bit about me. And now I'm going to turn it over to Deb.
Hi, everybody. Many of you I've spoken with before, but for those that I haven't, welcome. I've been doing this. I need to update that slide because it's probably going on 13 years now. I have been helping folks that need and could benefit from FES cycles figure out how to get one at home. And I've just learned so much. I learn more from my clients than they ever would learn from me. You guys are just such a wealth of great information and resources. And in my spare time, I do live in Florida with my husband, and we are big kids at heart, and we love the theme parks. We love cruising. We love fishing on the beach, just everything that's pretty much goes along with Florida. So welcome.
All right, very good. So we will go ahead and get moving here. But first, we do have a couple of polls for you. If you don't mind participating, we're just curious. It'll help us kind of tailor the conversation tonight. Do you or your loved one have any of the following conditions? So spinal cord injury, multiple sclerosis, stroke, or brain injury, or none of the above. Go ahead and vote if you can figure that out. We'll give everyone a minute or so here to do that. All right, we'll go ahead and publish this. So it looks like we've got some spinal cord, some MS represented, and then some none of the above. So kind of a little bit of a mix there. And then our other question is, have you or your loved one ever tried FES cycling? So if you don't mind letting us know. Okay, looks like only one person has, and the rest of the group hasn't. So hopefully this will be really informative for you to kind of get a better understanding of, what FES cycling is. So very good. Thanks for your participation on that. All right. So first we're going to talk about what is FES. So FES stands for functional electrical stimulation. So essentially we're taking very small electrical pulses to cause muscles to contract and assist with functional movements, even when those muscles are weak or paralyzed due to a neurological injury or illness. So we have a little video here to kind of demonstrate. So you'll see these are electrodes that are just placed over the muscle. And this muscle that we're targeting in this video is the quadriceps. So that electrical stimulation is applied through these electrodes. And then you can see how contracting that muscle causes the knee to straighten. So this is what we call FES evoked activity. So it's really just the muscle that's being contracted through the electricity that is causing that motion.
Here we go.
Move forward. So when we talk about FES cycling, we are talking about applying that FES to the major muscles of the lower body to assist with pedaling a stationary bicycle. So I'm going to show you this video here. I'm going to turn off the volume on it. So you can see we've got electrodes here on a number of muscle groups on her lower body. So FES bikes in general are typically motorized. They are wheelchair accessible. So you can see she's just rolled up in her own manual chair. The Myocycle can also be used from a power wheelchair or just kind of any sturdy, stable chair that you might have at home. And again, really intended for people who have muscle weakness or paralysis. So the muscles that we can stimulate with FES cycling, the quads, like I pointed out on that other slide here on the top of the thigh, the glutes on the bottom, your hamstrings on the back of the thigh. We can also target muscles of the lower leg. So here you can see on the front of our little diagram here, the front of the lower leg, this muscle is often impacted when we're talking about foot drop. So anyone who struggles with foot drop, it's good to stimulate this muscle. And then the calves we can stimulate as well. And then we can also stimulate muscles of the trunk. So we can stimulate abdominals, back muscles to provide that core strengthening. So why do we do FES cycling? Well, we know when someone has a neurological injury or neurological condition, it often results in that person being significantly less physically active. And we know how important exercise and just movement in general is. And it can just lead you to develop a number of secondary health conditions when you're not getting that same level of activity. So everything from muscle atrophy, so that's kind of like the shrinking of muscles that happens, spasms or spasticity, just an overall breakdown of the musculoskeletal system. It's kind of a use it or lose it type situation. Reduced cardiorespiratory fitness, pressure sores, obesity, heart disease, diabetes, stroke, depression, and just overall reduced quality of life. So FES cycling, it's therapeutic exercise, and it's indicated for, or we kind of refer to these as the FDA cleared benefits. So that can include muscle re-education, prevention or reversal of that muscle atrophy, relaxation of muscle spasms, increasing local blood circulation, and then maintaining or increasing the range of motion in the legs. So now we need to talk about the contraindications, or essentially when is FES cycling not appropriate or potentially unsafe? So first would be implanted electronic devices. So that's things like pacemakers, implanted defibrillators, other types of implanted nerve stimulators. It's possible that the electrical stimulation from the Myocycle could interfere if you have an implant like that. So it's not always the case. So we usually just require that we get a doctor's approval before we would move forward with potentially getting a Myocycle. So not an automatic disqualifier, but definitely need to confirm with the doctor that it would be safe. Severe osteoporosis or very, very weak bones. We are subjecting the legs to some force. So we do want to be careful in those situations. A lot of times it's just weighing risk versus reward because we do know that FES cycling can also improve bone density. So it's something that we definitely encourage people to discuss with their doctor. Broken bones or dislocation in the legs, and this is kind of a current broken bone. Any bones that have healed, that's not going to be an issue, but some, kind of an unhealed fracture, as we would call it, would put you in the kind of contraindicated category until that's fully healed. And then anyone with severely limited range of motion, if you have really significant contractures, that's going to pose kind of a mechanical barrier to cycling. Precautions, this is kind of our yellow light area. We just don't like to stimulate across or near open wounds or cancerous lesions. We really just haven't been able to establish the safety of stimulation during pregnancy. And then we just wouldn't leave someone unattended on the device if they cannot stop the device themselves. So how often should you FES cycle? So our recommendation is typically 90 minutes per week. That's what we see in the research as kind of being the lower end of where you'd want to be in order to see clinical benefits. So you can break that into 3 30-minute sessions or 2 45-minute sessions. On the higher end, we have folks who cycle 5 days a week, an hour a session. So I think anything within that range is great. We generally would recommend less than 2 hours a day, though, just because that could cause undue fatigue or pressure sores. And it just really isn't substantiated in the research that you'd need to do any more than that. And then we just kind of have the American College of Sports Medicine and CDC guidelines here, what they recommend as far as physical activity. So just kind of keeping all of that in mind. So now what we're going to do is just talk about the research and, what we see as far as potential benefits based on the condition. So we're going to start with spinal cord injury. I also want to mention that FES cycling is not a new intervention. There's over 4 decades worth of research to support FES cycling. So we have a lot of data, lots and lots of patients who have used FES cycling and have gotten great benefits out of it. So specifically with spinal cord injury, we see that FES cycling can improve cardiovascular and metabolic health. It can increase bone density. It can increase muscle fiber size and strength, kind of that reversal of the atrophy that we were talking about. It can reduce body fat, increase quality of life, increase neurological and functional performance. It can decrease spasticity. And actually, Kevin here is the gentleman pictured. He's had his Myocycle for quite some time. He was taking a medication that's often prescribed for people who have spasticity, baclofen. And he was actually able to kind of devise a schedule where he was cycling in the morning and then before bed, and kind of using that strategy, he was able to discontinue the baclofen, which is a really big deal for someone with a spinal cord injury. So it's been that effective for him at managing his spasticity. It can also improve walking ability in people with incomplete spinal cord injury. And there's also recent evidence to suggest that it can also reduce pain. When we look at folks who have MS, the research on FES cycling shows that it can improve circulation, strength, and wheelchair transferability. It can also improve walking ability in people with MS who are still walking. It can improve pain, fatigue, quality of life. There was even a study that showed that it can improve cognition. It was looking at processing speed. And we know that exercise in general has kind of a neuroprotective benefit. And of course, this is a form of exercise. So, and then again, we see that it can reduce spasticity. So overall, what we see within the research is that it is a safe way for people with MS to exercise, that there's little risk of adverse event or, triggering a relapse. Moving on to stroke or brain injury. So we see within the research within this population that FES cycling may improve trunk control, leg control, aerobic fitness, again, reduce spasticity. So that's a theme that we see across patient populations. Again, it can facilitate a faster recovery of walking when we kind of intervene shortly thereafter the stroke or brain injury. And then it can also improve balance. Kind of our last condition here is cerebral palsy. What we see within the research within this group is that it can improve balance, strength, aerobic fitness, gross motor skills, and coordination of the legs. There's a number of other conditions that might benefit from FES cycling, just kind of due to the nature of those conditions and how they affect the nervous system. But we may have limited to no evidence, research on it at this point. So that would include Parkinson's disease, ALS, PLS, hereditary spastic paraplegia, brain tumor, Huntington's disease. So if you have a condition that we didn't talk about tonight, I'm happy to kind of chat with you one-on-one to discuss, whether this would be beneficial for you or not. So specifically, just kind of want to chat about the Myocycle. So we are on our V2 or version 2 of the Myocycle. So that came out in April of 2022. So it's been about 2 years now, FDA approved. So it's available in 6 channels or 10 channels of FES. And so every channel is essentially a muscle group. So our home system comes with 6 channels. So you can kind of think of that as the left and right quadriceps, the left and right hamstrings, and the left and right glutes. So that's how we get to 6. The 10 channel is our home plus. So that comes with everything I just mentioned, plus a channel for trunk on both sides. So we can stimulate the abs or the back muscles, and then a lower leg channel. So left and right, the lower leg, again, either calf or that tibialis anterior muscle group. The Home Plus also comes with Bluetooth heart rate monitoring. So if you have a Bluetooth capable heart rate monitor, we can display that heart rate at the top of the screen while you're cycling. So something that's unique about the Myocycle is that we do have a patented technology that will customize the stimulation to you based on your proportions. So we just kind of take a couple measurements of your thigh length, your lower leg length, and seat height, gets plugged into an algorithm to make sure that the timing and kind of the on-off angles of the stimulation is best suited to you and your proportions. So it's really customized. It comes with an electric motor that will automatically provide assistance to pedaling when folks have deconditioned muscles, and it will start applying resistance automatically as you get stronger. So again, it's really tailoring the workout to you and what you're capable of. You can kind of see here from the pictures, but the pedals they're actually orthotic walking boots. So it's a little hard to see with the black on black here, but it does a really nice job of stabilizing the foot and the ankle. So if that's a concern, I think that's well supported, and I think people find them to be pretty comfortable too. And then the stimulation is very easy to adjust and kind of manage on your own. I always say that I kind of come along with the Myocycle. So if you get a Myocycle, we provide dedicated clinical support, and we're really passionate about that. I have to say, we have a lot of Myocycle users I've just never even spoken with because it is so intuitive and easy to use, and they feel like they've got it and don't really need my assistance. But of course, plenty of people I have really close relationships with because we chat often. So just overall, it's very easy to use. I think it can be pretty intuitive for a lot of people. So just also quickly, we released a software update within the last probably 6 months or so that allows the Myocycle to kind of connect with third-party fitness training apps. So Zwift, if that's anything that you're familiar with. Essentially, I'll just kind of show it in action here. Let me mute this because this is a loud video. So you can kind of see here, this gentleman is cycling. This is just an iPad that we draped over the screen of the Myocycle. So he's controlling an avatar within that app based on, his output on the Myocycle. So it's just made cycling a little bit more fun and engaging. You can kind of cycle through different environments and things like that. You'll see other people kind of whizzing by, or you're passing other people, and it can be really motivating in that way. So that's just a recent software update that we pushed not all that long ago, and just something else that makes us unique, I think. All right. Oh, I'm going to play this again. There we go. Okay. So I am going to turn it over to Deb now, and she's going to kind of dive a little bit more into the logistics of how you can go about getting a Myocycle for home.
Alrighty. Hi, everybody. I see we have a couple questions. We'll go over all of those at the end of the presentation. My part's not going to be that long, but if you do eventually decide that getting a Myocycle and FES cycling is right for you, then I am there to help you figure out how to do that. And the first step is typically a call with me, and many of you I've spoken with. For those that I haven't, I am very laid back. I am no pressure. I just like to chat with folks, get some information about your situation, and then answer questions so that you can have all the good information that you need to make the right decision. And, you know, the bottom line is we want to make sure it's safe and we want to make sure it's beneficial. And then once you decide that you would like to figure out how to get a Myocycle at home, the main thing is figuring out the funding for it. And some folks are able to just purchase out of pocket, make that decision. Some folks do financing. Some people look to fundraising. A lot of folks do grants and foundations. And then we have some that do vocational rehabilitation, victims of crime services, those type of specific services for folks in those situations. And then insurance. And I will tell you, we just recently did a review of all of our folks that have gotten Myocycles. And with the grants and foundations, within just the past couple of years, folks have gotten almost $400,000 to get Myocycles in their homes. So that's a huge thing. That there really are programs out there to help you get one. If purchasing out of pocket or financing isn't the right thing for you. So, I'm always happy to chat with you about that and try to just dig into your situation to see what would help you best. As far as insurance goes, insurance is not the most successful way to get a Myocycle and not the quickest, but it certainly can be used at times. What I usually recommend to folks, because the insurance process takes a very long time, I usually recommend that you look at the other funding resources. And if you find funding for your Myocycle, great, you get it right away. But that doesn't mean we stop the insurance case. We still will pursue all the options in there. And if we're successful, then you get a reimbursement. But at least you've had the benefit of your Myocycle while we do that work in the background. Alrighty, and so then the next step would be we need to obtain a prescription from your doctor, and there may be some other documents needed, especially if we're going to do an insurance case. We have templates, and I can help with that, so we make it very easy. Some folks ask me, well, why do I need a prescription if I'm going to purchase it out of pocket or use a grant? The prescription does not really have anything directly to do with the insurance submission. And a lot of people think you only need a prescription if we're doing insurance. We need a prescription because the FDA has it cleared as a Class 2 medical device, which requires a prescription. So, but it's a very easy thing to do. We can get that for you without much work at all. And then the next step would be once you've figured out funding, collecting that payment, we create the work order, and we get your Myocycle shipped out. Right now, we are shipping in a week or less. I had somebody that was able to find funding for his Myocycle this morning, and his system is already on the way. He is very excited and can't wait to get it. So that was a great turnaround for him. And it goes by UPS ground. So when you do get your Myocycle and it leaves here, you get an email with the UPS tracking number, great written instructions. You also get 2 videos, a video on how to do the basic assembly and a video on how to start using your Myocycle. And we get great compliments all the time about how easy it is. And once you get your Myocycle, you receive the following support. And she's number 4 on here, but as Liz said, she comes with every Myocycle. And Liz's expertise and her experience is invaluable. People tell me all the time how helpful Liz is with helping them make sure that they're meeting their goals and progressing on the Myocycle. It is therapy after all, and we want you to progress on it. But we also have a great technical support team. If you have any issues or questions, they're great at helping resolve those. You will also get a weekly progress email. Every Monday, you get an email, and it tells you how you did with your sessions the week before. That's a great way to stay motivated and to, just make sure that you're doing well and going in the right direction. And then we also have a Facebook community page. This is a private page just for folks that have a Myocycle at home. And it's a great way to stay connected with other Myocycle users. I love when somebody comes on that page and asks a question, and before I can answer it, our other users are answering it. And I think that's wonderful. It's a great community to be a part of. All righty. So some of the comments that we've gotten from our home users, Dr. Calabrese was one of our very first users of the Myocycle. He has MS, and he said that the greatest benefit from his Myocycle is his improved mental attitude as he is able to once again participate in cardiovascular exercise. He became limited as to what he could do, and the Myocycle kind of stepped in and filled that hole for him and helped him continue to be active. Todd, who has a spinal cord injury, he said, since using the Myocycle, I have seen a marked increase in the size of my leg muscles, as well as an increase in density. My waistline has stabilized with some decrease. It's not just noticeable to me, but also my wife, extended family, and friends. When used regularly, my spasticity is decreased. And then we have Sheldon. I think we saw a picture of him earlier. He had a stroke. Since starting with the Myocycle, I have regained sensation in my lower leg. I can kick out my leg, lift my leg, and have more stability standing. And then just a couple more. Marcia, who has MS, said, my husband said, this is the best thing we ever purchased to help me. And the other day he said, honey, you've got legs again. I loved when she called and told me that. We had a good chuckle together. And then Dustin, who has a spinal cord injury, he said, I feel better overall, which allows me to be more active in the house and on the farm, as well as playing a larger role in helping take care of my daughter. Everyone I've interacted with so far at MYOLYN seems to genuinely care and have an investment in mutually or maximally improving my quality of life. It's not just a good product, it's the good people that you get with it that turn a good experience into a great one. We love hearing that, of course. And then Sean, who has MS, said, I enjoy walking and traveling. The Myocycle has helped me to resume walking community distances, which has greatly improved my independence and overall quality of life. And then just two more. Marty, who has a spinal cord injury, said, for the first time since my SCI, I feel like an athlete again. I do my workout first thing in the morning, and it improves my mood for the rest of the day. That's a thing that we don't always talk about, but how this can affect you emotionally and mentally, and how much better you can just feel overall. And then I think this is the final one from Mike. He said, the system is a very easy setup. My experience with the staff at this company has been extraordinary, both in purchasing and setup, as well as any issues I have had afterwards. These are extremely knowledgeable and professional people working for this company. And we love all those compliments. It's why we do what we do. And we really do appreciate it. So we're a team. As Liz mentioned, she's there to help you make sure that you use your Myocycle correctly. You're going to get all the benefits out of it and you progress. And I'm here to help you figure out how to get it at home if that's what you decide you'd like to do. We are both here to help you in any way that we can. I'll turn it back over to Liz.
All right. Well, we have both of our contact info here on the screen, so don't hesitate to reach out to either of us if you have a question. But I will start to address the questions that came through in the Q&A. Thanks for your patience. So Davina says, my son has a spinal cord injury. So yeah, I'm not sure if he's been able to trial an FES cycle before, but I'd say that that's the population where we have, a lot of research. There's just really a ton of benefits in that population. And it should really be kind of the standard of care when someone has a spinal cord injury, because there's just no other way to recruit those muscles, after spinal cord injury. And electrical stimulation is the way to actually get those muscles activated. So Yeah. And then Lisa asked, can FES be used by people who have spasticity? The answer is absolutely yes. We see kind of over and over again in the research that, consistent FES cycling can really go a long way in managing and reducing spasticity. Like I mentioned, one of our spinal cord injury users has even been able to kind of wean himself off of his anti-spasticity medication. So absolutely. And then Victoria asks, is it painful? So that's a great question. It depends on, what kind of sensation you have preserved. So a lot of times, again, with the spinal cord injury, sometimes your sensation is impaired. And so then it's really not a barrier to use. And in fact, with our patients who have spinal cord injury and they don't have sensation, the typical use is pretty much the maximum amount of stimulation, because the more stimulation that we drive into those muscles, the harder the muscles contract, the better the workout. So that's typically our approach. If you do have sensation or your sensation is impaired, there's certainly a level that you'll reach where it might start feeling uncomfortable. Absolutely. So for me, I don't have any impairment in my sensation. And if I use the stimulation from the Myocycle, again, the level of stimulation goes up to 50. So for me at about level 5, that's about the most that I can tolerate, but I'm also starting to get a good contraction at that level. So yeah, it certainly can be uncomfortable, I would say. We wouldn't encourage anyone to use an amount of stimulation that is painful. We just want to use an intensity that's enough to get those good muscle contractions going. And a lot of times people also will kind of accommodate to the sensation of the stimulation over time, whether that's kind of within one workout where you just kind of start to adjust to it, or, over time, over weeks to months of cycling, sometimes, your body just kind of gets used to that and it becomes more tolerable. We've also got some other tricks and kind of things up our sleeve that we can use to try to make the stimulation more comfortable, using bigger electrodes. And there's another parameter that we can adjust to try to make it a little bit more manageable for people who do find it to be uncomfortable. So great question. And then Lisa also asks if FES cycling works for exercise if you have cerebral palsy. So yes, absolutely. That's kind of one of the, I would say, 4 main populations where, the research has been conducted on FES cycling. I actually just spoke with a gentleman yesterday. We had a video call who he has adult CP. And so he just started using the Myocycle. He told me he felt a pretty immediate relief in his spasticity. And it was just kind of like a brand new sensation for him. So I'm really excited to see how he progresses. I think that it can be really beneficial. Again, we see that within the research, it can improve gross motor control, which is, a really big deal in folks with CP. So yeah, absolutely. Okay. Back to Davina. She says he has tried something similar at Shepherd Center, really wants to use one at home. Yeah, great. That's what we like to hear. It's always nice to have that experience, in the clinic before getting a Myocycle at home. Just gives you a better sense of what to expect. But we have plenty of people who, choose to get the Myocycle. They understand what the benefits are, but maybe they haven't tried it in the clinic yet. And, that works as well. So good. Hearing that one of the users ended his baclofen meds was very good to hear. Yeah, I don't want to say that that's the norm, but I think it really can have a significant impact in managing spasticity. So I think I've talked with a lot of people who have been at least able to kind of taper their baclofen. So yeah, absolutely. Okay. Next question. Does FES cycling help when spinal cord injury is considered complete? How? Yes, absolutely. So when we talk about a complete spinal cord injury, we are saying that there is no motor or sensation that's transmitted, below the level of the injury. So we really, in that scenario, there is no, like I mentioned earlier, there's no way to get those muscles to contract except spasticity, but that's kind of an undesirable muscle contraction. There's no way to get those muscles firing. And so what we often see with folks after complete spinal cord injury is that they get that really significant muscle wasting, which has an impact on your metabolism. If you aren't carrying as much muscle, that really can kind of affect that. That's why folks with spinal cord injury are at higher risk for developing diabetes, and of course, all the complications that come with that. So, and again, that being complete also means likely that you don't have sensation. And so that's where, in a way, it's actually kind of beneficial because we can really be aggressive with how much stimulation we use to really get those muscles contracting so strongly, and you'll get a ton of benefit out of it. So yes, absolutely. We use it with complete spinal cord injury, and hopefully my answer how that works makes sense, but I'm happy to elaborate on that further too. Okay, you may have answered this in relief of spasticity. Yeah. So exactly, in terms of, muscle, reversing that muscle atrophy, we see that consistently through the research. We can actually influence the muscle fiber type within the muscle, which is really wild. So basically we can shift the muscle type from a fast fatiguing type of muscle, which is kind of what happens after spinal cord injury. Since those muscles aren't being used, they kind of change to a fiber that is very quick to fatigue. But through FES, we can actually make them more fatigue resistant. And of course, again, reverse the atrophy and improve muscle bulk. I was actually just chatting with someone else today, and I was referencing an article that showed, kind of compared to people who just did like range of motion and stretching, the folks who did FES cycling saw like a 36% increase in the volume of their thigh. And that's because of that addition of muscle. That same study also showed that there was like a 44% reduction in the amount of fat that's within that muscle too. So, it's very well researched and very well established that, we can see those kinds of changes with FES. Yeah, thank you, Dafina. Those were some really fantastic questions. I don't want to hold anyone up. We appreciate you guys joining us and taking some time out of your Thursday evening. Deb and I are here to answer any other questions that you may have. But that's the end of what we have planned as far as the content for this evening. So again, we'll stay on, we'll answer as many questions as come through, but feel free to hop off if you've got other plans. Must see TV, I guess. I don't know. I don't think that's a thing anymore, but I don't know if Survivor's on these days. I've fallen off the wagon with the Survivor. So, all right. I don't see anything else coming through. So again, feel free, take our contact information here. If you have more clinical type questions, I'm happy to answer them for you. Just shoot me an email, liz@myolyn.com. This is my cell number, so you can call, you can text. I'm happy to answer any other questions that might come up. And then, of course, hopefully a lot of you have already been in contact with Deb, but that's her contact info there as well. We are at your disposal. So since I don't see anything else, oh, there's one more here that just came through. Good to see you, Deb. All right.
Thank you, Dafina. I look forward to chatting with you further, and we'll figure this out. That's what we do.
All right. Good. Well, thank you again for taking time out of your Thursday evening to join us to learn a little bit more about FES cycling and the Myocycle. And again, just don't hesitate to reach out if you have any questions, if there's anything we can do for you. So we'll go ahead and we'll sign off for this evening. Take care, everyone.
Bye-bye.
Bye.